We have a very comprehensive cardiac program here, and one that I think all of Newfoundland and Labrador can be proud of. Eastern Health certainly is. We have great outcomes, and our wait list management has improved, so our waiting lists are down, and we're certainly very proud of the work that's done by cardiology. So there may be things that crop up that we can't do here, or that we're just not in the right ballpark for the numbers of patients that we might see that you would need to have received reliable. He was very comprehensive in the workup and the diagnosis and in the referrals that were given to him.
Can you give us any indication as to what type of diagnosis was given?
I can't really. I mean, that really is patient confidentiality, and even if you are the Premier, you're entitled to that kind of confidentiality in your patient record.
So what do you think of the Premier leaving the province for healthcare then, specifically?
I think that the Premier has done what he was recommended, that the physicians that were involved in his care here looked at the best possible options for him and certainly gave him those options, and he's acted on it, and we wish him a very speedy recovery, and we'll be glad to...
You mentioned that there are some... So can you give me an idea of the range of things that aren't available here in the province?
And then we'll try to narrow down which one he might be having. Well, let me tell you that it's not quite as clear-cut as that, and I'm not just being coy. So, for example, I'm a 56-year-old woman. I've got a history, and this is true, I've got a history of mitral valve problems. I'm overweight. I'm under stress. Somebody looking at that would say, we might do mitral valve replacements on a regular basis, but we don't do fat older women. So we're going to send you somewhere else for that because they've got a real specialization, or they've developed a new technique. So they'd send me out of the province for that, perhaps. For example, we now have about 50 patients on the list for surgery, and they're being done within the appropriate wait times for their...
Does Eastern Health feel about the fact that the most prominent citizen in the province had to leave?
I feel absolutely thrilled that the workup was done here and that he had confidence in the system and that he was prepared to take the advice of our physicians, and certainly that speaks to his, I think, confidence and support for the entire healthcare system.